power in my neighborhood.
You know, Cass, you talked about accountability, and all three of you actually have talked about accountability. You talked about those, Greg, those 18 complaints lodged against that officer. Is that where some of the frustration creeps in when you see something, a track record like this, 18 complaints, and here this guy is right back out into the community?
It looks like that behavior is being condoned. You know, if I do something wrong and you're my boss or you're my superior or you're someone that has some influence over me and you constantly see me out here doing things that are wrong and you don't step to me and say something, then you're co-signing what I'm doing because you're not speaking up against it. Now, they fired those 4 officers, but what they should have done is fired them and then charged them. Then I don't think the whole city would be burning down right now because it's a playbook. We've seen this play out so many times. You know, we see someone get killed. They try to criminalize the victim. You know, if they do fire the person or do something minimal, it's to appease everybody. And then if it even makes it to where they're charged and they go to court, most of them don't even get that far and they don't get any jail time.
Sure.
So what are you saying in the totality is that this is okay. This behavior is okay. We're going to give you a slap on the wrist because if I put my knee on someone's neck outside and everybody saw it and the person died, I'd be in jail quick. There would be no, we need to look at the tape further and, you know, he might have had a medical condition and, you know, you don't know what happened before that. We watched this officer with his knee on this man's throat for 8 minutes. There are so many points and times where he could have taken his knee off this man's throat. I mean, you had community asking, you had this man calling for his mother who had died 2 years. I mean, it broke my heart.
It was heartbreaking. Great characterization. Heartbreaking. I think we'd all agree there.
I mean, and I'm sitting there looking at my TV like, this can't really be happening. And then you have the other officers just standing there. So we talk about the good officers. I'm going to need them to step up. Because if you're a good officer and you see someone doing something wrong, I'm going to pull your coat. We might be friends, but I'm going to say, hey, come here. You are wrong. You know, you need to get it together. I know what you're going through, but, you know, you can't do this. You can't just stand there. So they're all, you know, condoning this behavior. And for him to have his hand in his pocket, he looked calm, cool, and collected while he squeezed the life out of this man.
Yeah.
No concern, no type of, I'm upset, nothing. Horrible, despicable.
You can't think that this is unique to people like Cass. You know, there's probably a lot of people who feel the same way on the accountability end, and you have others that, you know, standing by.
Yeah, you're looking at one. I mean, truly. And I think, too, what I hear is some of this is about the culture. Some of it is about what people can't really see inside. And what we tried to do, what we do here is we were one of 6 pilot agencies that wanted to look at that history, that track record. You know, your offenses, your use of forces, your complaints, all of that in a big data so we can see and we rate those people who score high on misbehavior. And we really make sure we've fired quite a few of them because we don't want that to become entrenched. But again, it's deeper than that when you talk about trust because all of that work seems to be thrown out the window when you have something this egregious because it takes you back to a time of Jim Crow and before where it was illegal to do those kinds of things. So I understand, too, the need for having that arrest. I wish there was something I could do and, you know, wave a wand and make it happen sooner. But the issue that we have sometimes is the officer who's in a union has more protection than the general public. I get that, too. So there are a lot of other nuances that add to the frustration and the misinformation and the lack of understanding, thus a lack of trust. So you got to chip away. I've been at this inside for quite a while, and it's frustrating because you can think you're making progress, and then this puts you back similarly or feeling like you're back at square one.
You know, you came into the business. You talk about being in the business for a while, nearly 3 decades. You were a little apprehensive and suspicious of the business before you even got into it.
I just didn't like cops. I mean, I wasn't apprehensive. I came in here because I thought I was going to see what I've been feeling, what I'm hearing about, and I wanted to deal with it head on.
Why didn't you like cops?
Well, I had plenty of reasons not to like cops. I saw what was done to my family in particular and some of my friends. I didn't like the way they treated people in my neighborhood when I grew up. I didn't like the way they talked to people. And if my dad dies and you don't investigate it, I have no use for you, period.
Driven by race in your...
I don't have a doubt. That's exactly what I attribute a lot of that to, is race, especially at that time. I couldn't see anything else none of the other quote-unquote factors and variables would explain away what we were seeing.
Well, let's touch the elephant in the room, race. You know, Greg, you talked about it with your daughter and some of your family members. Any doubt in your mind that these actions were driven by race, those officers?
Not a single doubt in my mind. That officer, I seen a demon in his eyes. I seen the same look that I seen when I look at people getting hung from the KKK. I seen the same look. That's the same look that has existed in this country since slavery. And that look hasn't changed in those people's eyes. And to see how cool, calm, and collective he was with his hands in his pocket and looking at the camera, I knew he was sending a message to people that thought just like him, to entice people to do the same thing. And I know that was a hate crime, that was bigotry, that was racism, and that was him trying to wipe out one of us purposely.
Feel any differently, Cass?
No, I agree 100%. I definitely agree. I mean, just the look on his face and just his body language. You know, his body language, he was too calm, cool, and collected. You know, and what upsets me is if that was a black man that did that to a white man, we wouldn't be having this conversation because he would have been fired and he would have been arrested. There's no doubt in my mind, cop or not. Because, you know, you had the Muslims, the officer that was from Somalia, I believe, that shot the white woman. And guess what happened? He went to jail and he got 12 and a half years. So, you know, you have to look at the black and white of it, you know, because it's in your face. You know, even if right now when you look at, and I call it weaponized whiteness, when you have these people who are calling the police on black people for all types of things.
I like that.
The man asked her to put her dog on a leash.
And she's referencing the Central Park
Right,
incident that
in
happened not too
Central
long
Park,
ago.
Amy Cooper. And she calls the police saying that she is being threatened and attacked. But what? Those cops could have came and killed that man. And the only reason why she apologized is because her investment banker company that she works for now got rid of her. They even made her give her dog back. But I think what upset me even more about that is people were more upset on social media about the condition of the dog. Oh, she was choking the dog. I get that, but this black man could have lost his life.
Shows
You
what our
know,
priorities are as a society. Sure.
Right, and we've had so many of these. Kids selling water, someone going to the pool, golfing while black, sleeping at your dorm. I mean, where does it end? And so, you know, we have this message being sent out to people, law enforcement and white supremacists and racists, that they can utilize this power to not only oppress, control, and sometimes kill people of color. This is the problem.
Chief?
Well, you know, we're talking about parsing out specific variables in race, and it's almost like we want to have a snapshot of one incident, and that's what I keep telling you. You can't do that. I mean, everything you do is through various perspectives, and I told you mine. It took me a while to believe that, you know, this was not the most racist profession. I mean, I felt that way coming into it, and when I start working with some of the best people that I'd met who happened to be white, it gave me a broader perspective. But again, what I have to do when I look at this is look at it through a lot of lenses. And, you know, you don't, and again, this is why I preach to people, use that smartphone, capture it, give us evidence, because I want to hold that accountability. And you know, you separate race out. Anytime somebody's mistreated, we need to address it and hold accountability. But especially when you see groups that have historically been in that position, it's even more of a need to have accountability, because that's the trust that's so hard to get and so easy to lose. So we got a lot of work to do, and not talking about race or trying to separate everything from race is not going to get us where we need to be.
You come into the profession under the assumption that this is a racist profession. Now that you've been in the profession for nearly 3 decades, what are your impressions about the profession now? Is it driven by race?
Well, the whole profession, absolutely not. I do think, though, we do have some people who have race issues, who are individuals within this profession. You can't separate it out. We're not any different than anybody else. Everybody falls back on how we recruit and how we train, but what we're trying to do is better educate. You know, we talk about the study where we show, you know, how you are quick to basically vilify black people based on what you see, doing the same action. What we don't talk about is the way to overcome that is to connect with people, especially black people and Latinos, consistently to change that perspective. We're trying to do some of that work, which is going to take a while. I mean, we didn't get here yesterday. We didn't get here in the last 30 years. But the problem is it's getting frustrating because it's taken so long for us to work through it.
On the recruitment side of things, so that there's no doubt in your mind that in the profession, maybe even here locally, we've got people with some racist cops that are in the profession, and maybe even here locally. How hard is that to detect and pick up on during background checks? How would you even decipher whether somebody's got those kind of toxic feelings in their heart?
Right. What I tell you, we got a lot of behavioral issue interviews that we do, and we look at your track record. We have denied people and told them you have to come back when you show us proof that you've been working in a diverse community. We have a lot of people who come here who have been in basically a monolithic town where it's just one race basically, and it gives us some concern. We tell them come here, do some things locally, get involved and see how diverse we are as a city, and then you want to serve in that city. But there's no, I wish there were a pill you could take that would give you pristine, perfect people. They don't exist. And we keep talking about racism in the PD. Racism is everywhere. I mean, you have racists everywhere. And I don't know that is how pervasive it is. It's not my job to really concern myself with it. I got to hold accountability to the behavior and look for indicators that we need to address.
Well, and I don't think anyone would disagree that regardless of the profession, you're going to find racists in that profession. I guess where critics would come in and say, but this is the kind of profession that those racists could take someone's freedom away and possibly, potentially, take their lives away. So there is a difference here.
I don't disagree. You're preaching to the choir. What I tell you is that's why I challenge all departments to do some of the work in trying to get the intrinsic study of a person, right? Knowing deeply what they're about, more so than if you got good credit, how do you express yourself in writing and communication, those generic and I think surface level things, get deeper into who that person is and what they're really about. So you can tap into and look at their history. And so you can tap into those people who genuinely want to do the right thing for all people. That's what we're seeking to do. It's not easy and obviously it's not perfect.
Now, you talked about that response to resistant policy that was updated, and that didn't happen in a vacuum. It was the former use of force policy for the department. That didn't happen in a vacuum, right? It was put together through a lot of community input. Sure. How important is it that the community weighs in on how they want to be policed?
It's critically essential, but again, people think that you get the policy right and you're covered, and it's not that simple. I mean, the law is the law. And there are nuances to it around, do you feel your life is in an imminent lethal threat right now?
And that's in the eye of the beholder.
It is. It is. So we do a lot of training. We do conversations. We're talking about the education around differences in race and culture. We're trying to expose them to a lot of things so that when they fall back to that legal standard, they have the context, the full context of everything with that, and they're making their decision based on truly and as objectively as we can make it humanly, whether or not that life is in jeopardy. It's not based on a factor that they intuitively almost look at when they think about violence, which could be a black person or something else. We're trying to get to the core safety and survival mode, which is hard to overcome everything else that comes with it. So we're doing a lot of training to get you comfortable with people who are different than you, so that decision isn't based on anything like that, as best as we humanly can.
Cass, you're the queen today. You get to lay down the scepter and, things that, actionable and reasonable that you think recognize should require some attention. If you can make some changes, they would be what specifically?
That's a big question. I think, first of all, when we talk about fearing for your life, that's different for everybody.
Sure.
Now, we could be in this room right now and something can happen and I could be scared to death and everybody else could be perfectly fine. So I think that maybe needs to be narrowed down a little bit more, like reasonable, because you have some of these officers that are afraid of all types of things. We've had people being shot with wallets, cell phone, all types of things. And I think that's a problem. But I think, like you're talking about some of these policies being changed and the community input, but I think the community at large has no idea. So maybe there should be some type of campaign to get this information out to the broader community. you know. And when we talk about making, well, I won't say making these officers, but kind of immersing these officers into community, a lot of these officers might not want to do that. You know, that maybe that's not what they want to do. And by making them do that, that might not be helping the situation either.
Well, maybe this isn't the profession for them.
Right,
then.
right. You know what I'm saying? Because
That's the whole point about it, is if you
Right.
don't have people who genuinely want to do
right,
it,
right.
they might not deserve the opportunity to do
You
this
know,
work. I'm sorry,
because,
go ahead.
you know, you're fine. It's just, you know, I see police officers and I see them doing great work with children in the community and, you know, taking the kids out and, you know, doing all this great work with kids. But in my mind, I think when that little boy becomes a grown man, are they still going to embrace him in the same way?
Yeah.
Or are they going to see this big black man as a threat and gun him down? And that's what I'm concerned about, you know, and that's why, I have a lot of reservation in dealing with a lot of things. I mean, we had a whole conversation. I've had a lot of negative experiences growing up in New York with the police, seeing them in my neighborhood, seeing certain things, you know, go on. And that's hard to put aside, especially when you keep seeing the same behavior, not just here in Charlotte, across the country.
Yeah.
You know, so it is a problem with policing, and it's also a problem with the laws. You know, this country was built on racism. I'm just going to speak facts. So a lot of these laws are built to oppress people. So we can't get around that. So there's a lot of things that need to change for us to move forward. But I think everybody needs to be honest about what the real problems are. You know, we keep tiptoeing around it, and, you know, we touch the surface a little bit. We really need to really dig deep and really talk about the racism and the systematic, you know, and really dig down deep so we can actually change, because we got to get honest before we can change things.
Well, speaking of honesty, you know, Greg, you were great on the front lines in 2016 during the demonstrations of,
Yep.
you know, Keith Lamont Scott, when you really emerged onto the radar.
Mm-hmm.
What prompted you, and, you know, how much in lockstep are you with Cass, you know, when we're talking about tiptoeing around the issue instead of taking it head on?
Absolutely. I mean, she's absolutely right. 2016, honestly, it was about Keith Lamont Scott, but it wasn't just about Keith Lamont Scott. There were murders all over the country from 2015 to 2016 of unarmed black men by a white officer. And that us ignoring it like it couldn't have happened here is what made it such of a big thing for me personally, because I think even I had these blinders on, like it's not gonna happen here. And it happened here, and my level of tolerance, it just went through the roof. So now I'm very zero tolerance about that happening again. And that won't be accepted, and it's not wanted. But I also hold myself accountable in my own neighborhood. And like I was listening to Bobby Seale on the way over here, and listening to his speech, he was saying the same exact thing that I had in my head. And I thought that was an injustice to him. That was an injustice to anybody that died for me to have the privileges and the rights that I have right now, that I continuously have to talk about this. So right now in this moment, yes, I want the training to continue. That has been happening because we had great strides with these new trainings that was happening inside the police department, where it was helping superiors that I was working with identify certain characteristics in an officer that he probably shouldn't have. It was helping officers identify what accountability is. If your partner is having a bad day, should he really take the lead? Things of that nature. Those things were brought to the forefront in these type of trainings that I was involved in. So yes, I want to see those trainings continue. But then I also want to see us mobilize as black people. I want to see us be able to come unify with one voice, with an agenda that we want to accomplish as one. And that's so important in our neighborhood. And I don't want to use the term neighborhood watch, but sometimes in your neighborhood you have to police the police.
Yeah, police
And
watch.
you have to be on point about what's going on in your neighborhood, and that's something that I take a lot of pride in, and having officers that I do know, and being able to not just dial 911, but to dial somebody's cell phone. You know, that social capital, that cachet, it means a lot. And sometimes I think back to some of these things. If it was somebody around that had that cachet, would it be the same situation? It might still be the same situation, but it would also be a different message that was put on that phone that was filming that man die. you would see a unified front happening in that moment as that man has his knee to his neck. The fear that's in the black community, I just want to obliterate it. We can't be scared to step up and move and mobilize as a unit.
Oh, there's a difference between, sorry, Chief.
Let me just say this, though. I mean, hopefully we'll get there, because I've been having these conversations for quite a while, and talk is great. But what I'm talking about is what does success look like? Mm-hmm. We're saying policing the police. To me, all that is community policing, because you know who these people are, who are policing you, and you explain to them the way in which you want to be policed.
Yeah.
Hard to do in a bigger city, hard to do in a, I'm just saying, it's not easy.
But I think we've been doing that, and no one is listening.
Well, we've been trying, but you have. And here's the other thing, guys. I know the work you're doing in helping people who are hurting. You're doing that right now. I appreciate you taking the time. I know you're working with a family now. I know these things with people who are doing right, and I give them credit. But we talk about changing laws, and I came in here thinking I'm going to change everything.
Yeah.
And now I know I can deal with policies, but it takes time to really, I can change all the policies and laws in the world if I were king, but who's going to abide by them when you're not looking?
Yeah.
That's where we're trying to go. So the way to do that is you have somebody you can call, know the first name, and say, hey, man, this ain't right, right? Mm-hmm. And then you know that you're going to hold that person accountable. The issue is scaling that up to a point where
It's systematic.
Finally know we have a voice inside who can hold the people accountable to the level you expect them to.
Absolutely.
It doesn't have to be everybody. We're not going to stamp out racism in America in my lifetime.
No.
But what we can do is fight it with everything we have on a unified front.
Yeah.
And that's how we do it. And I don't need, I thought I had to change the minds and hearts of everybody who came through the academy. I don't have to touch the select few who are going to do that work with their peers better than I ever could. Yeah. That's kind of how I've changed my perspective on what we're trying to do and what we're trying to get as an outcome.
It's systematic change that needs to happen. And sometimes, like, even in the community, I'm not going to change the mind of every person that's in my neighborhood of how they feel, but I can change the culture of my community. And that's what I believe Chief has been doing as a chief, is trying to change the culture of the police department in Charlotte. And but it's systematic change that we have to talk to. Fixing people isn't going to change the problem.
Yeah, but Greg, you know, you being as community driven as you are, you threw the word accountability out there. You would argue that you do take ownership. You do have accountability, the responsibility. It's got to break your heart, situation aside, and what prompted it, to see community members burning a community down like this. That's the antithesis of responsible. Look at us in 2016. And we get that pent up anger, and they want to have a voice. You had a guy, Justin Carr, young kid, just out there demonstrating who lost his life and all that. Mm-hmm. I wouldn't call that responsible. Call that reckless, violent.
And it goes both ways. I think that
Good afternoon. I'm Dena Diorio, Mecklenburg County Manager, and I'm joined today by Gibbie Harris, our Public Health Director, and Deputy Chief Jeff Estes from Charlotte-Mecklenburg Police Department. I do have a couple things to go over today, but before I turn it over to those two, obviously, as everybody knows, the governor's order goes into effect at 5 p.m., requiring that everybody in Mecklenburg County and the state wear face coverings when being out in public. Mecklenburg County, the towns in the city of Charlotte are very pleased that the governor has taken this step and really eliminated the need for us to do anything locally here to require face coverings. And our board particularly believes that the state's requirements are consistent with what we would have done here locally. So we're very pleased at the outcome. And in response to that, I'm very, very excited today to announce a really exciting initiative. Mecklenburg County will be joining with Atrium Health and with the Charlotte Executive Leadership Council to distribute 2 million face coverings in Mecklenburg County. Mecklenburg County received 1 million free face coverings from the federal government, and the Charlotte Executive Leadership Council, under the leadership of Gene Woods of Atrium Health, are also donating 1 million masks, and we will be combining efforts to make sure those gets distributed widely through the county. We are working with VOAD, which is the Volunteers in Action During Disasters, which is part of emergency management and has been active during the entire pandemic, to use their really extensive network to help us get those distributed. So we're very, very excited about that. We're getting our plans together now, and we'll hope to have something in place in very, very short order. But I just want to say what a unique public-private partnership this is, that the private sector and the public sector have come together to make sure that everybody in the county has face coverings if they need them. We'll be working very closely with our nonprofit organizations as well as our faith community and small businesses to make sure that they have face coverings for their parishioners, for their customers and clients. We know small businesses, particularly now that they have the requirement that they have to that customers have to wear them, we want to make sure that they also have them available should they need them. So we're very excited about that. We're getting ready to do a press release on that, but I wanted to announce that here this afternoon. And I think we know that the masking requirement is very much a public awareness campaign. And if you listened to our Business Leaders Roundtable earlier in the week, you know that we revealed a media campaign that will start to air next week. And it basically focuses on the 3 W's: wear a face covering, walk 6 feet apart, and wash your hands. And I'm going to show a little bit of that to you today. But first, I want to thank Ray Ward, AC&M, which is a multicultural marketing firm here in Charlotte, as well as Center City Partners, for really leading this really, I think, incredible effort. So the first slide that you see up on the screen is really the name of the campaign. It's called Count on Me CLT. And it was designed to align with the state's campaign, which is Count on Me NC, which really has the same purpose, is to raise awareness around the 3 W's. Next slide, please. Billboards will begin to go up across the county next week, and they'll be targeting specific audiences that have been disproportionately affected by COVID, including young adults, the Hispanic population, African Americans, the elderly, and the LGBTQ community. Next slide, please. To ensure that we're reaching those groups that we believe are more disproportionately impacted by COVID, we work with multiple partners on the messaging, including the Asian American, Latin American, LGBTQ, and the Black Chambers of Commerce. They've been very, very instrumental in helping us make this a reality. Next slide, please. So here's an example of a billboard that we will use that we hope will encourage folks to comply with the order. Next slide, please. As well as an ad. This is an ad that will run next week in the Charlotte Business Journal, again, encouraging people to comply with our 3 W's. Next slide, please. This slide obviously is in Spanish, and what it says is, distance today, together tomorrow, do it for them. So this is one that obviously will be targeting the Hispanic population. There'll be billboards and posters throughout the community. Next slide, please. And this is a billboard that reminds people about the 3 W's, as well as sort of a pictorial that shows what the benefits are of wearing face coverings. So all of these messages will be going out starting next week, and this will be a campaign, next slide please, that will run for 12 weeks. It'll include radio, TV, and print ads, as well as grassroots campaigns to spread the word and how important it is to follow the 3 W's. This is being funded from a grant from the COVID-19 Relief Fund, and again, we want to thank them for their incredible generosity to help make this a reality. Just from a county perspective, now that we will be in phase 2 for an additional 3 weeks, we are delaying our plans to reopen county facilities until at least early August. We had been planning for some time in July, but in the meantime, we will continue to provide our services virtually, and we will continue to have the vast majority of our employees working from home. And then specifically to Park and Recreation, we are going to continue to accept field athletic reservations for use starting on July 6th in compliance with the governor's order. Youth and amateur sports organizations will be able to schedule fields for practices, conditionings, and drills, which is a change from where we were. And per the governor's executive order for phase 2 reopening, only baseball and softball games are allowed. In addition to that, we will reopen our restrooms at all of our park facilities beginning on July 6th. We've been getting a lot of requests for that. And I do want to say before I hand it over to Deputy Chief Estes that our sign language interpreter today is Richard Hafner, and as always, today's virtual press conference is closed caption for the hearing impaired. And with that, I will turn the mic over to Deputy Chief Jeff Estes from CMPD. Thank you.
Thank you. As the manager said, we have a new order, and with new order comes new enforcement issues. And with that, I hope to be able to explain what the governor's order said and how we'll be enforcing it. So the first part is, and I think that probably the most burning question on everyone's minds, is that this order does not authorize individual enforcement of the mask or the face covering mandate. So you won't have officers out stopping individuals to say, hey, you're required to put your mask on. We will only be on an enforcement, an education platform to be able to tell people, when we run across them for whatever reason, just to remind them to wear the mask. We won't be in a position to criminally enforce that. The order, in fact, doesn't allow for that. Now, there is a provision that allows us to enforce write citations to businesses who don't meet the mandates for the order, and we'll be doing that again only after we've had educational time with the business to make sure they understand what they're supposed to be doing and in the manner in which they're supposed to be doing it in conjunction with our public health officials. Now, I do suspect that there will be some issues with people who don't agree with the face covering mandate and who will get into disputes with businesses who are complying with the face covering mandates. And in those occasions, we've told officers that, of course, we won't be enforcing a face covering mandate individually. However, if a person tries to enter a business or enters a business, they're turned away for failure to wear a face covering, then that would turn into a trespassing or other applicable charge, which could be and would be enforced through the regular statutes that we do today. So in other words, that wouldn't be a face covering enforcement action. That would then in turn be a trespassing issue and incident, just like we would do already. Now, for compliance with the order, we want to make sure that all of our employees, of course, are compliant with the governor's orders. And so through that, our employees will be wearing face coverings just like you see here that I've worn like this when they're out in the performance of their duties. Additionally, if we have specific COVID calls or systematic calls, we will go to the higher particulate mask, the N95, as you know. As an organization, just to tell you, we're doubling down on our temperature checks. We're making sure that we're keeping everything clean. We only have a finite number of officers out in the field, and we have to make sure that, that together we all keep a good, solid workforce. So in summary, we won't be enforcing mask mandates per the individuals. We can enforce through citations for businesses. And lastly, we recognize that there may be some people who will want to enter businesses and not wear a mask. In those cases, if a business tells them that they have to leave and they refuse, of course, that would turn into a trespassing incident, and we would treat it as such. Lastly, CMPD is doubling down on our efforts to keep our employees safe through the rest of this pandemic time. So with that, I'll turn it over to Gibbie Harris.
Good afternoon. As of this afternoon, Mecklenburg County has reported 9,427 confirmed cases of COVID-19. We've had 148 deaths and 20 congregate living facilities that are currently in outbreak status. Our trends have not really changed. Our positivity rate is at 10.3% over the last 14 days. That is a very, very slight decrease. Hospitalizations, 134 average per day over the past week. That is an increase from 115 last week. Our case fatality rate is at 1.6%, so it remains quite low, which is good. We also continue to see a decrease in social distancing in Mecklenburg County. The things that we are putting a lot of emphasis on right now, you've heard us talking about the need for increased testing in the county. We continue to work with all of our partners. We are seeing increases in testing through C.W. Williams. Our hospital systems continue to do significant testing in the community, and we're starting to see an increase in some of the facilities, the pharmacies in our community doing testing as well. That's all good news. In addition to that, we will have our clinics this weekend on Saturday and Sunday at the Valerie C. Woodard Complex at 3205 Freedom Drive. That will be Saturday and Sunday, both days 9 to 3. We will be doing mostly drive-through, but we do have a walk-up testing option for those who may come by bus or just walk in. We're doing this with support from the General State Baptist Convention, and we'll have volunteers from a number of our local faith community partners there as well. The testing will be available to anyone who meets the following criteria. Anyone who's experiencing COVID-like symptoms, anyone who has been in close contact of a confirmed COVID-19 case, anyone who works in a congregate living setting as a first responder or other high-risk setting, and anyone who has attended a large gathering or protest recently. There is no appointment required, but we do have a limited number of tests. We'll be able to test 1,000 people a day. What we ask you to bring is a form of photo ID, if you have it, your insurance card, if you have it. There will be no cost for any of the testing that's done on those 2 days. And we ask that you enter by the Ashley Road side. We're looking forward to a good turnout on those 2 days. We know it's going to be hot, so we would suggest that you bring water with you as you come, and we will do our best to move the folks through the process as quickly as we can. Again, just reinforcing the whole prevention message. The testing is critically important, but what we have to do is continue to manage this infection. I've said many times that we continue to have COVID-19 spread through our community. We still have many, many individuals who have not experienced COVID at this point in time and are susceptible to the infection. As you heard from the CDC this week, they believe that we probably have 10 times as many people infected in our community as we have actually been able to test and find who are positive. So we know it's out there. We need to do what we can to prevent it. And when we can't prevent it, we need to be able to manage the spread so that our hospital systems are available to take care of individuals that are ill and need that care, but also so that we continue to have individuals who are able to work in all of the businesses that we've been able to open through phase 2. So it's important for all of us to wear our masks. You've heard that several times today, to social distance, and to continue to wash your hands. Those are the 3 things that we know are really going to help us manage this infection. So at this point, we'll be happy to take any questions you might have.
Hi there, Gibbie. It's Hunter with WCNC Charlotte. With so many law enforcement agencies in our area and across the state saying they won't enforce this mandate, do you think this mask mandate will be effective at all?
Do you want to answer that one? Hold on just a second.
I guess I should be speaking on the effectiveness of it. What I think the confusion around when it came out about people not wanting to enforce mask mandates, I think it revolved around the individual enforcement guidance. In other words, I think a lot of people believed that it would be where officers would be out in the field calling people over and joining people to wear a mask. And in today's environment, with everything that's going on, along with just the people who may not have masks, it really seemed to be, and quite frankly, is very difficult to enforce like that. I think that's where it came from. I'm not for sure how many of our peer agencies across the state felt that way. What I will say is effectiveness just depends upon if we are relying on law enforcement to make everyone adhere to a public health issue guidance like this, then we've already failed.
Follow up, Gibbie, do you believe it will be effective?
I believe it will help. It gets the message across that this is important. But again, it is dependent on the individuals in our community to do their part. What we know is that masks do help prevent the spread of the infection, and it is most effective when we're all wearing them. So hopefully there will be some extra support from this order, and especially if people are going into businesses where there potentially is a lot of exposure, the businesses are going to help us out with that as well. So I am hopeful that it will make a difference.
Gibbie, it's Allison Kusnich from the Charlotte Observer. Could you talk about fears over asymptomatic people and what you're seeing with that in the testing? Are you seeing a lot more folks who are asymptomatic testing positive for the virus?
I don't have the exact numbers of how many that we're testing are asymptomatic, but we are seeing not an insignificant number of individuals who are asymptomatic receiving positive test results. So we know that that is one of the situations that we're dealing with in our community, and everybody needs to be aware that just because somebody does not have symptoms does not mean that they're not infectious. That's why wearing the masks is important.
This question is for Dena. This is Eric Sandberg at the Business Journal. Dena, this is Eric Sandberg with the Business Journal. I'm wondering whether you have heard much from businesses being leery about having to enforce this or needing to enforce this, and if so, what are you saying to them?
I have not actually heard from any businesses that have indicated that they're leery about enforcing it. I think the biggest concern I have, and Gibbie and I talked a little bit about this, is particularly for small businesses, if somebody comes into your business and they don't have a mask and the business's ability to provide one, I think by doing this distribution, we'll be able to at least help some small businesses that aren't unable to access them. But I have not heard from a single business that has indicated to me that they are leery or will not do it.
This is a question for Gibbie. This is Hannah Smoot with The Observer. Just wanted to ask, with the 4th of July holiday weekend coming up, are you worried about seeing a surge in cases then? And what would you say to people who, you know, are maybe making plans to have gatherings or to travel over that holiday weekend?
So I think I think we can anticipate that people are going to be celebrating the July 4th weekend and are going to be looking for opportunities to be with the people that they care about and that they have fun with. And we want people to do that. We just need them to be safe and to be smart about it. I don't think there's any reason to restrict movement, although I do think it's important for people to wear masks and to social distance when they do that. We still have the restrictions on size of gatherings, So no more than 25% outside, no more than 10% inside. And we need people to continue to meet those requirements so that we can all be safe.
Gibbie, this is Derek Dellinger with Fox 46. I have a question in regards. I wanted to make sure I'm right on this. You said 1,000 people a day can't be tested this weekend at the site on Freedom Drive, right?
Exactly. We have the ability to do up to 1,000 a day. So 1,000 on Saturday, 1,000 on Sunday.
Okay, so that being said, is that going to be enough given the interest? And I think a lot of people do want to be tested, especially some that may have been involved in some of the protests. I would imagine that there's probably also increased interest otherwise from other people that will probably want to get tested. Is that going to be enough?
We don't have any idea. We have not done mass testing like this in Mecklenburg County at this point. I do know that all of the individuals that have been coming through the other testing sites in the community, the sites seem to be able to handle what comes through. So we really are not quite sure what to expect this weekend. We may not be able to accommodate everyone, but at least we'll have been able to provide 2,000 additional tests, and then we'll look to the future for more opportunities.
Gibbie, it's Allison Kuznets again from the Charlotte Observer. Do you think that mass and increased testing are sufficient to control the spread, or do you see a situation where there's more restrictions? We're seeing in other states shutting down bars again. Is that something that's on the horizon for Mecklenburg?
I certainly hope not, and that's, I know I'm sounding like a broken record, but that's why we continue to ask people to social distance and wear their masks. If we can manage this and avoid some of what we're seeing in some of the other states by making sure that we're managing this and not seeing any spikes in our numbers, which we've not seen so far. We've seen steady increase. We knew we were going to see that. But so far, we've not seen the huge spikes that some of the other states have seen. So hopefully people will do what we're asking of them and will help us manage this so that we can all stay out and about in the way we want to be.
This is a question for you. I was just wondering, who are these influencers that will be paid, and does it involve social media influencers?
There are a number of different influencers that we're considering, and we haven't landed on anybody in particular, I don't believe. I don't have that exact information with me, but I can certainly try to get it for you, Hunter, and send it off to you.
Hi, Dena. This is David Hodges with WBTV. I did want to ask about the governor's order in comparison to what the county was considering. I had several commissioners who were a little bit confused about it, thought that masks might be mandated in parks, and even Commissioner Fuller told me he would hope for something a little bit more restrictive. So why do you think the governor's order is enough and the county shouldn't do more?
So one of the things that what the state order does not do is it does not mandate face coverings on government property. So it gives each local government the option to do that. So on July 7th, I'll be bringing an action to the board to get them to vote to require face coverings on county property, which would include all county buildings, nature preserves, parks, everything. But right now, it does not include that, and we need an action of the board in order for us to be able to enforce that provision. So in that sense, we will be a little bit more restrictive only because the governor's order did not include that.
This is Katie Peralta with the Charlotte Agenda, and I had a question for Gibbie about testing and contact tracing. Gibbie, based on what you guys are seeing at the county level, based on testing results and the positive cases that you've seen, are there any, commonalities between the positive results? I know that we are seeing increases in young people still and in the Latino community. Mm-hmm. I was wondering if there's anything else you could share. In other words, are there a lot of young people who've been to breweries or people from traveling from a hotspot out of state? Or are a lot of these patients still, frontline workers who haven't been able to wear masks for whatever reason?
So, yes, we have seen continued high numbers in young people in our community. We have continued to see high numbers in our Latino community as well. We have not seen specific groupings of individuals. It is really and it's not always easy to know where exposure may have happened. In any given day, you might go to the grocery store, you may go out to eat that night, and you may have had a meeting where you were with 3 or 4 other people, and you could have been exposed in any of those areas. So to be able to pinpoint where exposures are occurring is not an easy thing to do unless we're seeing an outbreak in a facility of some sort or in a business. So at this point, we're not seeing large clusters like that. But as people get out and about more, if they're not wearing masks and not social distancing, we know they're being exposed, and potentially in a number of different ways.
I believe I heard this correctly, and forgive me if I didn't, but at the beginning of this, part of the marketing strategy is towards the LGBTQ community who's being hit at a disproportionate rate. How is that measured? What is that rate? And why are we seeing that community hit so hard?
That community is susceptible to lots of different things. We know they have high rates of smoking. So, I mean, we just know that because of the way they have interacted in the past, but these folks are working together. They're working with the roundtable. They're working with us to make sure that we're getting messages out. I don't know that they're necessarily any more susceptible than others. But we are seeing, again, because we're seeing numbers in our younger population, they're right in there with the Latinos and the African Americans and the whites who are in those younger categories.
Gibbie, this is Caroline Hudson with the Charlotte Business Journal. You said earlier that there could potentially be more of the free COVID-19 testing led by the county. I'm just curious, does the county have access to those types of resources? And if so, where will they come from? Will it be more partnerships?
Absolutely, more partnerships. This weekend is going to be possible because we are working with Mako Laboratories. They are actually performing the tests and running the tests. And because of a system that the federal government has set up, they can bill the federal government for the tests that aren't covered by insurance. So what we're providing is the logistics and the staffing support that's needed to make this happen, but they are actually doing the testing for us. If this works well, there's the opportunity to expand on that, but we're also looking at other partners in the community that can help us increase testing here.
Hi, this is a question for Chief Estes. Hey, Chief, David Hodges with WBTV again. I just want to ask, as County Manager Diorio just mentioned, if the County Commission does pass some more restrictions on where masks should be worn, including in parks, how might that change or not change at all CMPD's enforcement if masks are now required in public places like parks where you often see people not wearing them?
Well, I guess we'll have to see what the what language is used in the updated ordinances, and we'll go accordingly. I think that again, like I said before, it is very difficult on a practical, widespread matter to enforce individual mask mandates like that. But I trust in the process. I trust in the county commissioners and the county manager to be able to put forth a proclamation or an order that makes sense and practical sense, and then we'll follow along likewise. That's what we do for every proclamation and every order. So again, it's personal responsibility is the first order of business for our citizens to make sure that the public health officials, including our elected officials, are looking out for our best welfare when they ask us to wear masks. And then from that, we do our civic duty to wear them as prescribed.
This is for Dena Diorio. This is Derek with Fox 46 again. You had mentioned that this ad campaign that you're going to be doing, it's going to be lasting 12 weeks. Is there a reasonable expectation that this face order is going to last longer than I think a lot of people are assuming 3 weeks up until at least phase 3 starts? Are you expecting this to last longer, or is this just something you're doing that will extend out, just basically saying at least for the next several months, this is going to be the best practice if you're going to be out doing anything?
Right. Well, you're right. The governor's order only goes until July 17th, but we know that COVID is not going away on July 17th, and we're going to have to continue to take all the necessary steps to protect ourselves. And so we are going to continue to push these messages out over the next 12 weeks. We also have opportunities to use some of the federal dollars that we got under the CARES Act to do some real community engagement and do some real grassroots work on the ground to continue to get these messages out, whether it's direct mail or door hangers. So we feel like we're just getting started on this messaging. Clearly we're not nearly close to the end. So that's kind of our perspective. Last question, one more question. Okay, thanks everybody. Yeah.
One more question, Allison from the Observer. If I have a question for Gibbie, as far as the hospitals, could you talk a little more about what you're seeing in the hospitals? You had mentioned you're seeing more ICU beds being needed, but not as many ventilators. Could you talk about what's driving that and what the capacity is looking like at HM and Novant right now?
Both hospital systems are still in green status. They have seen some upticks in hospitalizations over the past 14 days, but we've sort of flattened out at that higher level in both hospital systems. And the variability of how many people are in intensive care beds changes fairly quickly. Right now, they don't have any problems with capacity in ICU beds, and we've been lucky that they have not needed as many ventilators at this point to treat the individuals that have come in with COVID. I think where we are in the process right now, we're still learning a lot about this infection. We're still learning about how to better treat it. But at the same time, our clinicians have had several months now to work with these patients and to find out what works, and we seem to be having some significant luck in taking care of the individuals that are coming into the hospitals. So right now, capacity is good. Right now, they're able to meet the demand, and that's where we want to keep it. Thank you. Y'all have a good afternoon.
Both directions